Addiction is a very serious condition. It is a chronic brain disease. This means it can last for a long time. It can also return, even after stopping. It is crucial to know addiction is not a moral failing. It is not simply a lack of willpower. People do not choose to become addicted. Understanding this simple truth is the first step. Addiction changes the chemistry of the brain. It especially affects how we experience pleasure. The human brain has a reward system. Certain drugs or behaviors strongly activate this system. This system uses a natural chemical called dopamine. Dopamine is released and makes us feel good. Addiction essentially hijacks this natural process. The brain then craves more of that intense feeling. When a person repeatedly uses substances or engages in specific addictive behaviors, their brain begins to adapt to these changes. Its actual structure and how it functions can alter. These significant brain changes are not easily reversed. This leads to a powerful, overwhelming compulsion. The person feels a deep need for the substance. Stopping becomes incredibly difficult for them. Because the brain itself is physically changed, sheer willpower alone is often not enough. Telling someone to just stop rarely works. It is similar to telling someone with asthma to simply just breathe normally during an attack. Addiction is a recognized medical condition. It requires proper care, understanding, and treatment. It is a health issue, not a defect of character. Addiction profoundly affects a person's decision-making. The brain becomes intensely focused on one primary thing. This one thing is obtaining and using the substance, or it could be engaging in the addictive behavior. Other vital aspects of life become less important. Clear logic and sound reason can be easily overridden. The addiction itself starts to drive their choices. It becomes a consuming and powerful force in their life. A person's impulse control also significantly weakens. The parts of the brain responsible for saying stop do not function as effectively as they should. These areas act like the brain's internal brakes. In the grip of addiction, these brakes often fail. The urge to use can become truly overwhelming. It is incredibly hard for them to resist this urge. This is a result of brain changes, not weakness. Priorities in a person's life change dramatically. Things that once held great importance lose their value. Relationships with beloved family and friends suffer. Performance at work or school often declines sharply. Personal health and well-being are frequently neglected. The addiction ultimately becomes the #1 priority. It gradually takes over the entirety of the person's life. This causes immense pain and deep distress for everyone involved. People struggling with addiction often feel utterly trapped. They may experience profound feelings of shame and guilt. There is usually a constant, exhausting internal battle. A significant part of them genuinely wants to stop, but the addiction exerts an incredibly strong pull. These individuals are not inherently bad people. They are people who are struggling with a disease. They truly deserve our empathy, kindness, and support. A great deal of stigma still surrounds addiction. Many people fundamentally misunderstand this condition. They might wrongly believe it is a simple choice, or they see it as a sign of a bad character. This prevailing stigma is extremely harmful. It makes individuals with addiction feel deep shame. It isolates them further from potential support. We urgently need to work to change these views. Stigma creates enormous barriers for those affected. It actively prevents people from seeking needed help. They live in fear of being judged or blamed. They worry about losing their jobs or their friends. This constant fear can be utterly paralyzing. It keeps people suffering silently and alone. We must strive to create safe, non-judgmental spaces, places where people feel they can finally speak out. Compassion is an absolutely essential ingredient. We need to approach people with genuine kindness. Open and honest communication is truly key. Listen carefully to them without passing judgment. Try your best to understand their difficult struggle. Judgment only serves to push people further away. It makes them feel even worse about themselves. Empathy, however, can build vital bridges to healing. Understanding addiction as a complex brain disease helps. It can significantly reduce harmful, untrue stereotypes. It naturally fosters empathy and much-needed support. When we correctly view it as a health issue, we can respond in more effective and helpful ways. This not only helps the person who is suffering, it also benefits their families and entire communities. Education is a vital tool in the fight against stigma. How can we effectively help someone who is struggling? First, it is important to learn to recognize the signs. These can include noticeable changes in their behavior, perhaps mood swings or withdrawing from social life. They might start neglecting important responsibilities, or there could be physical signs like sudden weight loss. Being aware and observant is the very first step. Observe them with care, concern, and without judgment. Gently encourage them to consider seeking treatment. Approach this sensitive conversation with great care. Choose a calm, private, and appropriate moment. Express your genuine concern with love and support. It is important to avoid anger or accusations. Focus the conversation on their health and well-being. Offer to help them find the right kind of help. Support them consistently throughout this challenging process. Many valuable resources are readily available to assist. Specialized treatment centers offer medical care programs. They also provide therapy to address underlying addiction issues. Support groups can be incredibly helpful for many. Well-known groups include Alcoholics Anonymous, AA, and there is also Narcotics Anonymous, NA, for drug addiction. Dedicated hotlines can provide immediate, confidential support. Professional help is often an essential part of recovery. Recovery from addiction is absolutely possible for anyone. It is a personal journey, not a quick or easy fix. There may be difficult challenges and setbacks along the way, but vital help and strong support are always available. People can, and indeed do, get better from addiction. They can successfully rebuild their lives and relationships. There is always hope for a much brighter future. Never give up hope on yourself or on others.